Domestic violence refers to the acts of violence that occur between people who have or have had an intimate relationship. While there is no single definition, the central element of domestic violence is an ongoing pattern of behavior aimed at controlling a partner through fear. In most cases, the violent behavior is part of a range of tactics to exercise power and control over women and their children. Domestic violence includes physical, sexual, emotional, and psychological abuse. It occurs across all socioeconomic, racial, religious, ethnic, and age groups within the population, although those regarded at highest risk include Aboriginal and Torres Strait Islander, young and pregnant women, women with disabilities, women experiencing financial hardships, women from culturally and linguistically diverse backgrounds, and women and men who experienced, abused, or witnessed domestic violence as children. Violence against women is one of the most serious causes and consequences of inequality and one of the key risk factors for women entering poverty and disadvantage. When we consider that 72,000 women and 34,000 children sought homelessness services in 2016-17 due to domestic violence, 1 in 3 Australian women have experienced physical violence since the age of 15. Almost 1 in 5 women have experienced sexual violence. Indigenous women and girls are 35 times more likely to be hospitalised due to family violence-related assaults than other Australian women and girls. Domestic and family violence are significant risk factors for child abuse and neglect, which often results in lifelong trauma. The question begs, how can domestic violence against women be minimalised and prevented in Australia today? The Department of Health recognises that DV is caused by a number of factors as listed, but these factors alone are not sufficient to generally account for abusive behaviour in men, suggesting that any number of variants within a system occur to create a single effect. Structural inequalities in society. Social reinforcements are evidenced in the workplace where a considerable number of authoritative positions are held by men. Women from culturally and linguistically diverse communities have difficulties accessing the paid workforce or higher education. The social learning theory suggests that violence is acquired and maintained in social areas including media, sports, friends, and social groups. The broad cultural denial of DV. There is a lot of shame and responsibility women feel as their role of wife, mother, and grandmother that prevent them from acting if they recognize the abuse in the first place. DV is linked to traumatic childhood experiences of abuse and witnessing violence as being a root cause for perpetrators' actions. Traditionally, men are taught to be tough. They have been brought up to suppress their emotions, and the phrases "be a man" and "big boys don't cry" are harmful and perpetuate that it's not okay to show any emotions other than anger. Cases of domestic violence were more frequently reported within lower socioeconomic groups, though most data being collected from DV services is in lower socioeconomic areas. The National Plan to Reduce Violence Against Women and Their Children is a primary prevention intervention that includes 3 action plans across a 12-year period. It supports innovative and targeted ways to bring about change through programs, grants, and research, with 6 targeted outcomes as listed. In 2013, Administrative Arrangements Order released by Department of Social Services, the Australian Government Office for Women as a part of the Department of Prime Minister and Cabinet. This is to ensure the whole government approach to providing a better economic and social outcomes for women that contributes significantly to primary prevention of DV. Current initiatives include providing strategic policy advice and support to the Prime Minister and the Minister for Women. They work across government to progress policy and programs to advance gender equality across Australia and ensure women feel safe and live without the fear of violence. The Office for Women also works across the government to progress Australia's policies on international matters relating to gender equality and women. As listed, there are a range of government-subsidised local support services available for women seeking to escape DV. Women's refuges operate after the abuse has occurred, a tertiary intervention that served to protect women and children from further harm and help restore healthy aspects of their lives. Refuges offer temporary accommodation, assistance of a caseworker who will listen to the victim's story and offer advice to improve their safety, assistance applying for apprehended domestic violence orders if needed, provide transport to and from crisis accommodation, court or other related appointments, help to navigate the legal system and make referrals to other services. Aboriginal specialist support provided by an Aboriginal and domestic violence specialist is also available. The staff aim to promote gender equality through assisting and encouraging the independence of the abused women and to help promote victim safety. The listed treatment programs focus directly on the perpetrator and their behaviour. They focus on teaching non-violent ways of coping with anger and highlighting the consequences of DV. Community-based professionals attempt to understand the DV from an individual and a social perspective. Factors including stress, lack of communicative resources, attachment styles are ones focused on and addressed. The effectiveness of these types of programs depends on the appropriate messages reaching the right audiences in order to change attitudes and influence behaviour. Data sources such as police accounts, child protection agencies, and housing support services are widely utilised to estimate the incidence and prevalence of DV. The victimisation surveys provide the most comprehensive measure. They can capture information about a victim's past experiences, regardless of whether they have reported the incident to the police or other services. Defining the data challenge for family, domestic and sexual violence is a project aimed at improving the evidence base. Key data measures that are required to define population groups, time periods and estimate current levels of risk include the number of people who have experienced family, domestic or sexual violence, prevalence rates for victimization, prevalence rates for offending, incident numbers and rates for victimization and perpetration. Research can be performed on a general level utilizing expert opinion, exploring community attitudes, or through case-controlled studies that identify risk factors and the prevalence of DV. Evaluations analyzing outcomes, client satisfaction, as well as the cost to run the program or service help policymakers and service providers identify efficacy. Collating evaluation data over time enables changes to be monitored and contributes to the building of the evidence base that informs future investigations, policy, and programming. A number of issues make it difficult to estimate the incidence and prevalence of DV that include false and underreporting, the amalgamation of multiple or serial victimizations in a single statistic, the loss of information about offenders in victim-based records, complexities in the way referrals to DV-related incidents are made, not being able to frame the assault as a criminal. The victim may not understand that they are entitled to protection from sexual assault even when in a relationship with the predator. Difficulties in linking data to see patterns in offending or escalations in violence, and the comparability between states and territories across the different data sources through the use of different recording rules. Recommendations include building the capacity of workers to train general practitioners, nurses, mental health, drug and alcohol, and other frontline health workers to identify and effectively respond to both victim and perpetrators of DV. Educational programs are more specifically targeted to population subgroups like Aboriginal and Torres Strait Islander women, pregnant women, young women, those with disabilities, those facing financial hardships, women from culturally and linguistically diverse backgrounds, and those who have had traumatic DV childhood experiences. Questions to support further research include: what are the characteristics of these particular subpopulations that place them at more risk or less risk of family domestic violence? Is there change over time? Are victims or perpetrators more likely to repeatedly form relationships that are characterized by violence? Thank you.